My name is David-Hanscom. I'm a spine surgeon who's been practicing spine surgery in Seattle for about 25 years. And I came out of my fellowship trained to do spine surgery, and I was very, very aggressive on performing surgery on people with back pain. And I did that for about 8 years. And after about 8 years, I started becoming really discouraged because my patients weren't doing that well. And in 1993, a paper came out from the state of Washington where it showed that the return to work rate 2 years after a spine fusion for back pain was only 22%. And then I started seeing people's spines break down above and below fusions, and those were huge problems, much worse than when they first started having back pain. So at that point, I'd been working with the rehab doctors, and I realized that there were other alternatives to pain and other parts of pain that I did not understand. And so I gradually transitioned into learning more about the other parts of pain besides just the structural problems. So when I first started, we were obsessed with finding the source of the pain. The idea that we just find the source that we would solve the problem. And then that wasn't working very well. And then on top of that, we would do the perfect operation on the perfect pathology, and often that wouldn't work either. So it wasn't making that much sense to me. And so in 1999, I moved to Sun Valley, Idaho, where I became a sole proprietor of a small spine practice. And I did everything. I went from being a tertiary, high-level spine surgeon to seeing people with 2 weeks of back pain. So I get to see the whole spectrum of care. So I took my surgical experience, my non-operative experience, my time with the physiatrist, and consolidated it into an organized care program. The difference was that I'm a surgeon. So I started taking sort of a surgical approach to non-operative care, which involves structure, aggressiveness, seeing people back frequently, making sure things were working. And it really evolved into a very structured game plan that's been very consistent. So that's how this whole process started. And I've learned a lot more the last 2 or 3 years with my own evolution in mental health, looking at the issues of sleep, stress, medications, how those all fit together. And we've come up with a very consistent pathway. It's worked extremely well.